Welcome everyone to another health and wellness video brought to you by physical therapy students. On this video, we will explain why monitoring your heart rate during physical activity is important and show you how to calculate your personal target heart rate zones. Let's dive in.
First, a quick disclaimer prior to starting any exercise or physical activity program. Why should you monitor your heart rate during physical activity? Take a look at the physical activity guidelines from the CDC, American Heart Association, and the American College of Sports Medicine. At least 150 minutes per week of moderate intensity physical activity, such as brisk walking. Get at least 150 minutes per week of moderate intensity aerobic activity, or 75 minutes per week of vigorous aerobic activity, or a combination of both, preferably spread throughout the week. To promote and maintain health, all healthy adults need moderate intensity aerobic endurance physical activity for a minimum of 30 minutes on 5 days each week, or vigorous intensity aerobic physical activity for a minimum of 20 minutes on 3 days each week.
Okay, everyone talks about moderate intensity. Why is this important? Well, the research shows a moderate intensity level is where significant health benefits and a reduction in chronic disease risk happens the most. In other words, in order to receive the health benefits of physical activity, we need to at least be active at a moderate intensity level. But how do we measure moderate or even vigorous? One great way to measure exercise intensity is, you guessed it, through heart rate.
There are a few different ways to measure your heart rate. You can use technology such as a chest monitor or a wrist-worn device. You can also check your heart rate manually by feeling for your radial or your carotid pulse and counting for 30 seconds, then multiplying by 2. Your radial pulse is found just beneath your wrist on the thumb side. You might have to feel around a little to find yours, but it is noticeable. Your carotid pulse is found on either side of your neck, just below the jaw. A normal resting heart rate for an adult will be between 60 to 100 beats per minute. You can also use the rating of perceived exertion, or the RPE scale, or the talk test to gauge exercise intensity without it. The RPE scale goes from 6 to 20, with 6 being sitting on the couch to 20 the hardest effort you can do. The talk test is also a good way to check to see how hard you are working. A moderate intensity level should be hard enough to prevent you from singing a song, but you could still talk to a friend.
So, to calculate your heart rate zones, we need to do some math. But don't worry, we'll keep it super simple. First, we need to find your maximal heart rate. To do that, multiply your age by 0.7, then subtract that from 208. For example, I'm 30 years old, so 30 times 0.7 equals 21. 208 minus 21 equals 187 beats per minute. This is my max heart rate. You can also use the old method, 220 minus your age. So for me, 220 minus 30 equals 190, but this method has been shown to underestimate max heart rate for older adults. If you're using a medication called beta blockers, you can use the equation 164 minus 0.7 times your age. This accounts for this medication's ability to reduce maximal heart rate. Next, we take our max heart rate we just calculated and subtract our resting heart rate to find our heart rate reserve. This is what we will use to calculate the intensity. So, for example, 187, my max heart rate we just found, minus 54, the resting heart rate, equals 133 beats per minute. Now, we calculate our moderate and vigorous intensity levels. We will take our heart rate reserve and multiply by 40%, and then add back in our resting heart rate. So, for example, 133, which was my heart rate reserve we just found, multiplied by 40%, or 0.4, equals 54 beats per minute. And then we'll add in my resting heart rate of 54 beats per minute for a total of 108 beats per minute, which is my lower level of moderate intensity level. We'll repeat this step using 59%, which would be the highest end of moderate intensity. In our example, this is going to be 133 beats per minute. So my moderate intensity zone is 108 beats per minute to 133 beats per minute. For vigorous activity, we'll use 60% for the low end and 84% for the high end, multiplying that by heart rate reserve. Alternatively, if you aren't interested in using heart rate, we want our perceived exertion to be between 12 to 14 for moderate intensity levels and 14 to 17 for vigorous activity. If we look at a real-life example for myself, comparing an hour-long walk with my wife and a 40-minute run, even though the walk is a wonderful activity, I technically was only working at a light intensity level, which has its benefits, but I could have walked just slightly faster to get my average heart rate up. And if I think about how hard I was working, I would rate it at about an 11 on the RPE scale, which again is slightly below the threshold for moderate intensity level. So, if I wanted the most health benefits possible, next time I can walk just a little faster or do some of the things that Miranda will mention now.
Here are some examples on how to change up your intensity during your activities. You can change the intensity by increasing your speed, performing intervals, adding extra weight with a backpack, weighted vest, or hand weights, walking up stairs or hills, taking less breaks, walking farther. You can also find a partner to help push you and keep you motivated. Hopefully you learned how to measure your heart rate, calculate your moderate and vigorous intensity zones, and why it matters. Thank you for watching.